Doctors ABCD is used at the very beginning of the first aid process. It's for assessing the situation and the state of the injured or sick person to decide how to proceed with first aid. Knowing first aid is important when someone is sick or injured. The acronym Doctors ABCD is a guidance tool to assess if CPR resuscitation is needed while keeping the patient safe. In stressful situations like medical emergencies, it is easy to miss important steps when performing first aid. Following the steps provided by Doctors ABCD helps by providing a step-by-step process to perform first aid. Knowing first aid is a vital skill that teenagers and young adults should learn. In emergency situations where someone's life is at risk, having someone trained in first aid on the scene can be the difference between life and death. If a medical emergency were to occur, having the ability to perform first aid helps improve the safety of those around you. First aid has also proven to be handy at places such as parties, sporting events, workplaces, and gyms.
The steps in Doctors ABCD are: Lee danger. Check if there is any danger that could affect you or bystander or the injured person. There may be something in the area that could be injured, and the threat may still be present. By checking for danger, you protect the injured person and yourself from further harm. Our response. Ask the injured person if they can hear you and have the ability to respond back to them. This is vital as there is a big difference on how to take care of a patient if they can respond and if they can't. Ask questions that challenge the ability of the injured person. This could include, can you hear me? Open your eyes. What is their name? Squeeze my hand. Send for help. Once you have confirmed there is no danger around you and check for a response, you should call 000. If you are alone, put your phone on speaker while talking to 000 and follow the first aid procedure they provide. If someone is near you, ask them to call 000 while you help the patient. Wait for help and listen to the clear advice provided by 000. Airways. Make sure the patient's airways are clear. Open their mouth and check for any bits of food or fluids. If the airways are not clear, roll the person on their side to allow fluid to drain out. Once their airways are clear, make the patient lay on their back, then tilt the patient's head back to open up the airways. Deep breathing. Check if the person is breathing. To do this, check the rise and fall of the patient's chest. You can also listen near the mouth for the sound of breath. If they are breathing, put the patient into the recovery position on their side. If not, make sure emergency services are called and begin CPR. CPR. Start CPR, make sure the patient is flat on their back, then place the heel of one hand center of their chest and your other hand on top. Press down firmly 30 times and give the patient 2 breaths. Keep going with the 30 compressions and 2 breaths for about 5 repeats every 2 minutes. To keep time, you can hum the song Another One Bites the Dust or Baby Shark. Defibrillator. A defibrillator is a machine that gives you instructions on what to do in a situation when CPR has started. If one is available nearby, it should be used as soon as possible after CPR has started. Defibrillators scan the patient and make difficult decisions for you about whether a shock is needed or not.
These steps are an excellent starting point in learning first aid. Furthermore, there are other techniques for reducing the risk of emergencies. Having safe work procedures and appropriate signage in offices, having working airbags and using seatbelts in cars, and storing hazardous chemicals away from children are simple ways to prevent medical emergencies and keep a safer environment for us all. Finally, Doctors ABCD provides a starting point in learning first aid. Safework.nsw.gov.au and osman.com.au provides dozens of additional resources and tips in keeping safe.